Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,366 new cases of COVID-19. This brings our statewide total to 24,199 Pennsylvanians who have tested positive now in all 67 counties. Approximately 1,179 of our total cases are in healthcare workers, and 1,688 of our total cases are in 215 long-term care living facilities, which include nursing homes and personal care homes. Tragically, we now have 524 deaths among those who have tested positive for COVID-19. And to date, all of the deaths have been in adult patients. The Department of Corrections today also has announced that one of those who has passed away was an inmate at the State Correctional Institution at Phoenix in Montgomery County. As of noon today, hospitals are reporting that approximately 2,205 patients are currently hospitalized in Pennsylvania due to COVID-19. This is approximately 10% of our total case count, and that has been consistent. 665 of those who have been hospitalized have required the use of a ventilator or breathing tube. Across our healthcare system, approximately 44% of hospital beds, 38% of ICU beds, or intensive care unit beds, and nearly 70% of our ventilators are still available. One of the questions that I'm asked most often is whether or not the social distancing that the governor and I have ordered is working. It's been almost a month since Governor Wolf and I ordered non-life-sustaining businesses to close their physical locations and allow employees to work virtually if possible. This has been a very difficult and hard sacrifice for Pennsylvanians. But the sacrifice is working. Our case count numbers continue to grow, but we aren't seeing the doubling of cases, that exponential growth, like other countries and states have seen. The number of people who have died also continues to grow tragically, but it really could be much, much worse. Social distancing works, and the closures are saving lives in Pennsylvania. If we stop those efforts now, our health systems will become overwhelmed, and then more will be lost to this dangerous virus, COVID-19. So we must stay calm, stay home, and stay safe. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. And if water is not available, please use hand sanitizer. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. These everyday prevention measures can help slow the spread of this virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health services because someone you know or yourself are experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-800-284-2494. Again, 1-855-284-2494. For For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From WGAL, what is your take on the decline from Thursday to Sunday? We're down 800 cases. Have we hit the peak, or does it have something to do with the holiday?
Well, we do not think that we've hit the surge or the peak at this time. But as I just mentioned, we are certainly seeing a plateau in the number of new cases. Now, the number of cases continues to rise, but that rate of rise has slowed. We have bent that curve. As I mentioned, we are not following that exponential rise where it doubled every number of days, but it's going in a more linear fashion. So it's going up, but much more slowly, and that's just great news. However, the best way and the only way to continue that progress is for people to stay home.
From Penn Live, you frequently talk about monitoring a number of models. Which models are you specifically looking at, and are those models broken down by region of the state, since the numbers reflect the virus isn't affecting all parts of the state the same?
Mm-hmm. Well, there's a model from the University of Pennsylvania, and that is primarily for Philadelphia. And there are also statewide models that we use from the University of Pittsburgh School of Public Health, as well as the University of Washington. Washington has a national model, but also broken down by state. There are some models from the federal government through FEMA, and we're watching those as well. And then some local health systems have developed their models. So we look at all of them, and we incorporate what they're saying, and we compare that to what we're seeing in terms of our daily data to make our plans for the future.
From Radio PA, what's the significance of the number of people who have tested negative for COVID-19?
Well, we watch that very carefully, and we watch the percentage of those tested in the state and what percentage are positive and how many that are negative, and those percentages give us an indication of how prevalent COVID-19 is in Pennsylvania.
From WTAE, a report the CDC published suggests that coronavirus can travel through the air at least 13 feet apart, more than twice as the social distancing guidelines. Have you heard this, and what are your thoughts?
So I have read that report, and we'll wait to see what the CDC says about it. But it just shows the amount of knowledge that we don't know yet about this novel or new coronavirus, COVID-19.
From Penn Live, Pennsylvania hasn't collected data about age, gender, race, and location for the coronavirus tests performed so far. Data, experts say, is essential for shaping policy for response and the scale back of social distancing. What is the Department of Health doing to ensure it has more information about who's getting sick and where the disease is spreading?
So we do have some of that information, particularly age and gender, but not as much as we would like, and particularly not as much about race and ethnicity. The issue is that we have an older reporting data system that requires manual reports, and of course the people doing the testing in hospitals and health systems and doctors' offices are trying to go as fast as they can, and they're not inputting all the data. We are asking them to do that and actually mandating that they do that, and we're looking forward to even more data. But we had been in the midst of updating all those data systems and to have them work electronically seamlessly, but we had not completed that by the time that COVID-19 hit. And so we're working with our current data system as best we can to get the data that is really important to help us make those decisions.
As a follow-up, Penn Live has a question about testing. What factors play into Pennsylvania's current coronavirus testing capability, And can we expect testing to expand further, for example, to asymptomatic people?
Well, so right now we are testing those that are symptomatic, and we're prioritizing those patients. We have testing available through our public health laboratory. Most of the testing is being done at hospitals and health systems and other healthcare providers. And then we do have a mass testing site that is coming online, back online in Montgomery County, and then one that we hope will come online soon in the Northeast. So we're working to expand our testing capability as much as possible. We do still suffer from lack of reagents or chemicals to do the test and the testing kits, so to speak, but we're working on sourcing those all the time. We're currently doing viral testing. In the future, we might be able to do serology testing or antibody testing, but that's not available at this time, and we'll see what role that plays in terms of our surveillance in the future. I can see a time, hopefully over the next number of months, where we will have enough test kits, enough reagents, enough testing capability to do more population-based surveillance testing of the virus as well, and that'll give us a better sense of the true prevalence of the virus in Pennsylvania.
We have several questions from PBS 39, WLVR, and Lehigh Valley Live about mass testing sites in Northeast Pennsylvania, and what are the plans?
Well, we do have plans for a mass testing site in Northeast Pennsylvania, working very closely with the Pennsylvania Emergency Management Agency and Director Padfield. That site has been chosen. We're working to get it set up and get the equipment there, the testing capabilities there, and we'll have more information about that later this week.
And then as a follow-up, Penn Live has a question. What's the status of the federal testing sites in Montgomery County and Philadelphia? Are they still operating, and at what capacity? So
the site in Montgomery County has moved, and it will be back operating, hopefully later this week. Philadelphia has decided that they don't need that mass testing site, that they have in Philadelphia adequate testing at other sites, and so it will not be set up there again.
From WNEP, Lackawanna County has at least 20 people who have died from COVID-19. That's more than in Luzerne County, which has more than 3 times the number of cases. It's also the second highest number of deaths per capita in the state. What are the reasons to the comparatively high number of deaths in Lackawanna County?
So a very important statistic that we have noted, but I do not at this time have an explanation for why that is true. Our epidemiologists will be looking into that to see if there's any pattern that we can discern in Lackawanna County.
From the Philadelphia Inquirer, last week, Governor Wolf said the White House is concerned about the Philadelphia area being the next hot spot, and that we would hopefully be getting more federal resources for Pennsylvania. Are you aware of any specific resources that the federal government is sending or plans to send here?
Yes, actually, the governor took a phone call from the vice president this morning, and we will be getting a shipment of N95 masks hopefully later this week.
From WNEP, we've seen reports that people who use medical marijuana are more prone to have serious complications from COVID-19. Currently, the medical marijuana community is considered non-essential. Is there any chance that designation will change?
So actually, that's not quite correct. The medical marijuana program continues in Pennsylvania. The dispensaries and the grower processors are considered essential, and the medical marijuana dispensaries are open. I think they're doing a lot of curbside deliveries to practice social distancing as much as possible. But medical marijuana in Pennsylvania is exactly that. It's medicine, so it is considered an essential service. It isn't medical marijuana that would predispose you towards having any particular complications from COVID-19, but it would be how it's delivered. And so smoking, medical marijuana or smoking tobacco, or vaping, medical marijuana and vaping tobacco, in theory could cause some underlying chronic inflammation in the lungs. And then if someone did contract COVID-19, they would have already decreased lung capacity and could be more prone to serious lung complications. And so that's the issue that we're concerned about.
From WNEP as well, does the Department of Health have any recommendations for landlords who may have an infected person living in an apartment building or a new tenant that's moved in from out of state?
Well, so if someone has moved in from out of state and they moved in from New York or New Jersey, then they're asked to quarantine for 14 days. If there's someone in their building that is positive for COVID-19, then that person would be in isolation, meaning they should not be leaving their apartment until they are better following the CDC guidelines. Of course, if that person was having severe medical complications, they would need to call their healthcare provider or an emergency call 911. But people coming from New York, New Jersey, etc., should be quarantined for 14 days. And if you're sick with COVID-19, you should be in isolation.
From the Altoona Mirror, is cremation recommended but not required for the bodies of COVID-19 victims?
No, there's no specific recommendations about that.
Okay. From Center Square, is the administration considering more programs to financially assist hospitals beyond the loan program announced on Friday?
Well, as you mentioned, the governor announced this loan program on Friday, and then there is federal assistance coming to hospitals and health systems, some of it being released soon, and then more further on.
From ABC 27, Republicans are pushing this week to open some segments of the economy that they say can operate safely. What is your reaction to that, and what do you say to critics who suggest that Pennsylvania has the most strict standards in terms of closed businesses?
Well, so the mitigation factors, as I was mentioning in my remarks, are absolutely critical to our state plan to deal with COVID-19. And the school closure now statewide for the rest of the school year, the closure of non-essential, non-life-sustaining businesses, and the stay-at-home orders are the main reason why we have been able to bend the curve and are no longer seeing that exponential doubling rise that we were seeing before. And that means it needs to continue. It is absolutely essential at this time that it continue. The governor is having discussions with other officials and actually some officials in other states. I believe that conversation is going on as we speak, as well as the senior staff and the secretaries about how we will look to the future and how we will start to open up in the future. But to do it now, even before actually, according to the University of Washington, we haven't even reached the surge yet, would be a mistake. That would cost lives and lead to the potential overwhelming of our healthcare system. I have actually been arguing for even more strict closure orders, and the governor is taking a very moderate approach, balancing, of course, the public health needs with the economic needs and the social needs of everyone in Pennsylvania. But to do any type of mass opening now would be a very big mistake.
From News Talk 104.1, there is a report from South Korea of a wave of positive cases after a patient was considered recovered. The WHO is investigating. Has Pennsylvania seen any types of these cases?
We have not, but I have read that report. And as you said, the WHO, or the World Health Organization, is investigating that report. And as I mentioned before, there is much that we do not know about this novel or new coronavirus.
From the Scranton Times-Tribune, a nursing home in a county in the Scranton area had 6 deaths and 10 positive cases in the last couple of weeks. Is the department doing anything about this outbreak specifically, and is any special monitoring put in place for cases at nursing homes when you see a large number of cases?
So I'm not going to comment on that specific outbreak, but we are working really, really closely with all of the long-term care living facilities. That includes nursing homes that the Department of Health regulates, but also personal care homes, and we're working in collaboration with the Department of Human Services, which regulate those homes. We have our staff talking to nursing homes that are having cases every day, and then we have hired a consulting firm, ECRI, to do further consultations and virtual consultations. And so we're doing everything we can to implement the nursing home guidelines or long-term care living guidelines that we put forward, as well as the CMS guidelines federally that were put forward, and to protect very vulnerable seniors in those facilities.
From Lehigh Valley Live, they're asking for a clarification for an answer we gave. Lehigh Valley Health Network says it's restricting testing to people 65 and over who show symptoms due to shortage in testing. Lehigh Valley is a concentrated area for COVID. How is the lack of testing impacting this region?
So we have reached out to Lehigh Valley Health System to see what type of testing materials or reagents they might need, and we will try to help them to resource that. And we're certainly prioritizing testing to those that are symptomatic, and we want to be able to expand testing to symptomatic people throughout Pennsylvania as much as we possibly can. Now, I've also said, though, that if you are a healthy adult and you have symptoms of COVID-19, you might have a low-grade fever, you might have a cough, but you do not have high spiking fevers, you're able to maintain your fluids, you do not have chest pain or shortness of breath, then you can certainly feel free to contact your healthcare provider, but basically, please stay home. As we've said, there is no medication for COVID-19 and there is no vaccine for COVID-19. And so if someone has those symptoms, please take acetaminophen for your fever and drink fluids and stay home and rest and recover. If you have other medical conditions which might predispose you towards having a complication, if you're a senior that might be predisposed to complications, if you start to have high spiking fevers, shortness of breath, chest pain, labored breathing, cannot keep down fluids, then you should contact your healthcare provider for further instructions and evaluation. And of course, if you have an emergency, please call 911.
From the York Daily Record, does the Department of Health report both confirmed and presumptive coronavirus-related deaths? If so, how is the health department going about getting the most accurate numbers for counties and keeping the coroners up to speed?
So we are looking at reporting on confirmed cases and other cases where we assume that the person would be positive, and we're looking at how that balance will be. And we will need to do further population-based testing, whether that's viral testing or whether that's serology or antibody testing in the future, to get a really good sense of how many people have been impacted by COVID-19. But right now we're concentrating on testing symptomatic individuals, particularly symptomatic individuals that need medical care.
Just to follow up, Secretary, this was in regards to people who have passed away from coronavirus and the testing, if they're considered presumptive positive and pass away. How are you counting that information?
So we have put out, thank you for the clarification, we have put out coroner's recommendations about testing, and if someone died of COVID-19, then of course they're considered. We do know that there will be individuals that have passed away and we might not be able to make that diagnosis. All of that will be looked at retrospectively after we're past this initial critical phase.
From WTAE, Westmoreland County's coroner said his office counts more COVID-19 cases than the state has reported. On Friday, the number was 11, and he added additional cases to the count over the weekend. Today, the state fatality total in the county is 6. Can you explain what's being done to address the coroner's concerns that there is a discrepancy?
So I wasn't aware of that discrepancy, but we will now have our team reach out and clarify it.
And then as a follow-up, Washington County's coroner says his office has been instructed that they should not be investigating COVID-19 deaths since they are natural. He believes this is contrary to Pennsylvania law as it applies to coroners. How is the state addressing the concerns of coroners?
Well, we have worked with the Coroners Association with coroners. We put out coroners' advice. There's an interplay between the hospitals and the coroners in terms of who's making the final diagnosis and of the cause of death. And so we'll try to collaborate with the coroners and the hospitals to work out those details.
From the Capital Star, will the department consider or redouble on its efforts to track recovered patients? 26 other states and territories in the United States are reporting recovery data, some based on hospital discharges. Why can't PA do the same?
Well, we are working to have recovery data based upon discharges, and we've reached out to PHC4, an organization that tracks discharges from hospitals, to get that data on a more timely basis. We will not be able to track recoveries of the now well over 20,000 cases in Pennsylvania of people that recovered at home, but we will be doing that type of surveillance population-based research in the future.
From WESA, on Saturday you said that before Pennsylvania begins to relax social distancing, the state would be looking at various data. You said one metric that health officials will use to make a sense of is the virus's prominence, or the percentage of new cases per capita that test positive during a specific period of time. What is the percentage you are looking for in order to relax social distancing? Mm-hmm. And can you explain how long that time period would be?
Well, it's not a number, it's a trend. So we are looking for many different factors to advise the governor in terms of relaxing social distancing. But the number of cases, the number of new cases and percentage up or down of those number of new cases, as well as was mentioned the number of the percentage of tests that are positive in a region. And we're looking for that over time to be going down in a consistent way. And so we'll be analyzing all that data and making recommendations to the governor. But the opening is not going to be one opening for Pennsylvania. It's going to need to be a progressive opening of different businesses in different areas, and then watching for outbreaks, and then that will continue as the governor tries to open up more and more parts of the state. But we watch for more cases of COVID-19 where it might be spreading, and then we'll have to take other measures. So this is going to happen in a progressive, iterative fashion.
As a follow-up to an answer you just gave previously, Capital Star and Penn Live are asking what the closures are that you had argued for that the governor has declined to implement.
Oh, we just talked about various businesses and other activities that could be open or closed. So there was, significant discussion, and overall, I mean, the governor has done an absolutely fantastic job in terms of implementing the mitigation factors.
And then, I apologize, from ABC 27, we are seeing that the state sent a letter to big box stores saying they need to close their lawn and garden centers since nurseries and the like had to close for being non-essential. What prompted this?
I think I'm not actively involved in terms of the business decisions. Those are handled by the Department of Community and Economic Development. But I believe it had to be with just being consistent with the different orders.
And then our last question is just a clarification on data. From the Press and Journal, how are counties seeing a decrease in deaths? Philadelphia County was once at 130 and now it's down to 127. Can you explain how those numbers change?
Well, the numbers change based upon the data that's inputted into our system. So we had seen a peak in terms of the number of new deaths per day, and we have seen a decrease, but we're going to continue to watch the data every day to see if those trends continue.
Thank you so much, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow. Thank you.